In this video lesson, we'll be covering a nurse care plan for the nursing diagnosis of risk for ineffective renal perfusion. We'll cover its definition, defining characteristics, related factors, expected outcomes, ongoing assessments, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing risk for ineffective renal perfusion. Risk for ineffective renal perfusion refers to the potential for decreased blood flow to the kidneys, leading to impaired kidney function. Common related factors are the following: hypovolemia, cardiac insufficiency, sepsis or systemic vasodilation, obstruction of renal blood flow, and the use of nephrotoxic medications. Alright, now let's go over the defining characteristics, which are the following: decreased urine output, elevated blood urea, nitrogen, and creatinine levels, altered electrolyte levels, hypotension, and evidence of systemic hypoperfusion. Now we will go over the common expected outcomes, which are the following. The patient will maintain adequate renal perfusion, as evidenced by stable blood pressure, urine output of at least 30 milliliters per hour, and normal lab values. The patient will verbalize understanding of measures to maintain adequate fluid balance and avoid nephrotoxic substances. The patient will exhibit no signs of fluid overload or deficit during hospitalization. Okay, now let's go over ongoing assessments and why they are done. Starting with the first one, which is to monitor urine output and characteristics such as color, clarity, and volume. Decreased urine output or changes in characteristics can indicate impaired renal perfusion or early kidney injury. Next is to assess blood pressure, heart rate, and mean arterial pressure, or MAP. Blood pressure and MAP are direct indicators of renal perfusion. A MAP below 65 millimeters of mercury may compromise kidney function. Next is to evaluate laboratory values such as BUN, creatinine, and electrolyte levels. Abnormal lab results can indicate compromised renal function or imbalances that require immediate attention. Therapeutic interventions are the following: administer IV fluids as prescribed and monitoring fluid balance. IV fluids restore circulating volume, improving renal perfusion, and preventing acute kidney injury. Administer vasopressors, if ordered, to maintain adequate blood pressure in cases of shock or systemic hypotension. Vasopressors improve systemic and renal perfusion by increasing vascular tone and cardiac output. Review and adjust medications to avoid nephrotoxic drugs or reduce their dosage. Reducing exposure to nephrotoxins minimizes additional stress on the kidneys and prevents further damage. Okay, let's now discuss patient education, which includes the following. Teach about fluid intake. Encourage the patient to maintain adequate hydration unless contraindicated. Teach about medication compliance. Educate the patient about the importance of adhering to prescribed medications and avoiding over-the-counter nephrotoxic drugs. Teach about lifestyle modifications. Discuss measures to manage underlying conditions such as hypertension or diabetes to prevent renal complications. Lastly, let's learn the positive evaluations, which include the following. Patient maintains a urine output of at least 30 milliliters per hour. Blood pressure and MAP remain within target ranges. Laboratory values remain within normal limits. This care plan provides a framework for addressing the risk of ineffective renal perfusion, emphasizing proactive assessment, targeted interventions, and patient education to ensure optimal outcomes. Well, that ends this video. If you found this video helpful, don't forget to leave a like, a comment, and subscribe for more nursing care plans and study tools.